Welcome to the Spinal Chat Podcast, powered by the Pennsylvania Chiropractic Association, where science meets purpose. This is our deep dive series, where we go beneath the surface of chiropractic research to uncover the findings that matter most to you and your patients. Today, we're breaking down a landmark study, association between chiropractic care and the use of prescription opioids among older Medicare beneficiaries with spinal pain, published in Chiropractic and Manual Therapies. We'll explore the science, the story behind the data, and how it all translates into better outcomes in your practice. Let's dive in.
Welcome to the deep dive. We're here to cut through the noise and really get to the insights that matter for you.
Glad to be here.
Today, we're tackling, a really pressing health challenge, spinal pain, and specifically how we deal with it.
It affects so many people.
It really does. And for too many, the go-to solution has often been prescription opioids, which, as we all know, come with their own serious hazards.
Especially for older adults, yeah.
Exactly. So our mission for you today is to unpack a pretty critical piece of research. We want to explore how a non-drug approach chiropractic care might actually serve as a safer, effective alternative.
Right. Potentially reducing the need for those opioid prescriptions.
Precisely. Our deep dive today is built around a significant study. It was a retrospective observational one published back in Chiropractic and Manual Therapies in 2022. And it really zeroes in on a population we hear about, but maybe sometimes overlook in this context, Medicare beneficiaries.
And that focus on Medicare beneficiaries is, I think, exactly what makes the study so compelling. We're talking about older adults here,
Right.
A group that, frequently navigates multiple chronic conditions, what we call comorbidities.
Okay.
And they're often managing several medications at once, polypharmacy.
That makes sense.
Spinal pain already puts a huge burden on people and our healthcare system. But for this group, finding safe, effective, non-drug alternatives to opioids, it isn't just beneficial, it's absolutely crucial.
I see.
So this research, then, it offers a really vital new lens, specifically for those who stand to gain the most from safer options.
That context really underscores the urgency, doesn't it? Let's maybe look at the bigger picture of this problem, because the source material paints a pretty stark picture.
It does.
Spinal pain isn't just, uncomfortable. It's actually a leading reason for opioid prescriptions in the U.S.
A major driver.
Yeah. And we're not talking small numbers either. The study highlights that between 2007 and 2016, something like 11% to 14% of Medicare beneficiaries aged 65 and older were prescribed opioids. That's quite a chunk.
It really is a significant percentage.
And here's where the data gets truly concerning. While overall opioid prescription rates maybe saw some decline in other groups, opioid overdose deaths in adults over 65 actually increased from 2017 to 2018.
Wow. Even as others went down.
Exactly. That's a really powerful signal, I think, about the unique vulnerabilities older individuals face with these meds.
Absolutely.
And what's even more striking, maybe, is that current clinical guidelines clearly state that non-pharmacological therapies, so drug-free treatments, are the preferred first-line approach for spinal pain.
That's the recommendation, yes.
Yet the numbers show this clear and, frankly, troubling gap between what's recommended and what's actually happening in the real world.
You've really hit on the core of the issue there, that persistent disconnect. Older adults, like you said, they metabolize drugs differently. They're more susceptible to bad reactions because of existing health conditions, and they face a dramatically higher risk of dangerous drug interactions from that polypharmacy issue.
Okay, so multiple layers of risk.
Exactly. So this isn't just about offering an alternative, it's about providing a safer one. Thankfully, therapies like spinal manipulation, therapeutic exercise, relaxation techniques, these are exactly what chiropractors often provide.
The kind of things the guidelines point to.
Precisely. The very types of treatments that current guidelines recommend as first-line or maybe adjunctive therapies for managing spinal pain.
Okay.
Now, previous research has certainly suggested that chiropractic care could reduce opioid use in, the general adult population.
Right. I think I've seen some of that.
But there's been a noticeable blind spot when it comes to specific data for older Medicare beneficiaries.
Oh, okay.
So this particular study is so important because it really steps in to illuminate that area. It gives us concrete evidence for a population that, desperately needs effective, safe pain management options.
Without the added opioid risks.
Exactly. Without those added risks. It helps us understand if this promising alternative truly benefits those at the highest risk.
So with that crucial context laid out, how exactly did this study go about investigating such a complex issue? What was their approach? How did they measure the link between chiropractic care and opioid use?
Yeah, they took a really robust approach. The researchers didn't just, guess. They actually delved into existing data. They did a retrospective observational study using a massive nationally representative sample of Medicare claims.
Okay, so real-world data.
Real-world data, looking back from 2012 to 2016, that's a huge data set, which adds a lot of statistical power to what they found.
And who exactly were they looking at within that data?
So they identified nearly 56,000 Medicare beneficiaries, 55,949 to be exact, who had been diagnosed with spinal pain.
Wow, okay, big group.
Very big. Then they divided them into two groups. One group, about 9,300 people, received chiropractic care alongside their primary medical care. And then a much larger control group, over 46,000, who got primary medical care alone, so without that chiropractic intervention.
Got it. And what were they measuring?
The main thing they looked at was the adjusted risk, and adjusted is important here, of these folks filling a prescription for an opioid analgesic at any point up to a full year, 365 days, after their initial spinal pain diagnosis.
That full year.
Yeah.
That's a good time frame. But you mentioned the groups were different sizes, quite different. How did they make sure it was a fair comparison? That they were really comparing apples to apples?
That's a really vital question, and they were rigorous about it. They used incredibly tight controls. They adjusted for all sorts of factors like age, sex, race, ethnicity, and each patient's overall health status, like comorbidities.
Okay.
And crucially, they also used advanced statistical methods, something often called propensity.
Propensity scoring. What's that in simple terms?
Think of it like meticulously balancing the groups. They create a statistical match between individuals in the chiropractic group and the control group based on all those factors we mentioned.
Oh, okay.
So that any differences they then observed in opioid prescriptions could more confidently be attributed to the chiropractic care itself and not just other underlying factors might influence, say, who decides to see a chiropractor in the first place.
Right, that makes sense. So trying to isolate the effect of the chiropractic care.
Exactly. These careful controls really bolster the trustworthiness, the robustness of their findings.
Okay, so after all that meticulous analysis, balancing the groups, controlling for factors, what was the big takeaway? What did these robust findings actually tell us about chiropractic care and opioid use in this group?
Well, the main finding is, frankly, striking. And it should really resonate with anyone out there looking for safe pain relief options.
Okay.
The adjusted risk of filling an opioid prescription within that 1-year time frame was a remarkable 56% lower among those who received chiropractic care compared to those who didn't.
56% lower. Wow.
Yeah. Let me put that plainly. Patients who included chiropractic care in their treatment plan were at less than half the risk of filling an opioid prescription for their spinal pain.
Less than half the risk.
Yeah.
That's huge.
It really is. And to illustrate the practical impact, they looked at something called the number needed to treat.
Okay, what does that mean?
It's basically how many people need to receive the treatment for one person to experience the benefit. In this case, the study calculated that, on average, if just 2.2 patients with spinal pain switch from getting primary medical care alone to adding chiropractic care,
Just 2.2 people.
one additional patient would avoid filling an opioid prescription.
Wow.
So this isn't just some statistical blip. It represents a real, tangible, beneficial shift in patient outcomes and a genuine opportunity to cut down on opioid exposure.
Less than half the risk. Number needed to treat of just over 2. Those are powerful numbers. But the study also dug into another crucial detail, didn't it? Something about the timing. When that chiropractic care started, did starting earlier make a difference?
Absolutely. And this is a really key point for, thinking about treatment strategies. The data clearly showed that early intervention is critical.
Okay.
The greatest reduction in opioid prescription risk, it was seen in what they called the early subgroup. These were the people who got chiropractic care within just 30 days of their initial spinal pain diagnosis.
Within the first month.
Exactly. For that group, the risk was an astounding 62% lower compared to those who didn't get chiropractic care.
62%. Even better than the overall average.
Significantly better. Think about that. Nearly 2/3 less likely to end up with an opioid prescription simply by seeking chiropractic care promptly.
So promptness really meant. What happened if care was delayed? If people waited longer?
Well, that's the other side of the coin. In contrast, if chiropractic care was started later, say, between 31 and 90 days, which they called delayed,
Okay.
or even later, between 91 and 120 days, the late group, it did not show a statistically significant difference in opioid prescription rates compared to those who didn't receive chiropractic care at all.
So the benefit kind of disappeared if you waited too long.
It seems that way based on this data. It really strongly suggests that early access to evidence-based, non-pharmacological care like chiropractic can make a truly significant difference in steering patients away from opioid reliance right from the start.
It's a compelling argument, then, for making these alternatives available and accessible right up front.
Definitely. Accessible and early.
Okay, so if we connect this timing aspect to the bigger picture, these findings about early chiropractic care seem to have even broader implications, maybe beyond just cutting opioid use, right? Did the source mention other benefits from previous research?
Precisely. The implications seem quite far-reaching when you look at related studies. The source material points to, for example, reduced surgery rates.
Oh, interesting.
Yeah, an earlier study found that among workers with back injuries, over 42% who initially saw a surgeon ended up having surgery.
Okay, that sounds quite high.
It does. But in stark contrast, less than 2% of those who first saw a chiropractor went on to have surgery for the same kind of issues.
Less than 2% versus over 42. That's a massive difference.
It's a huge difference. It really highlights the potential for chiropractic care to maybe significantly reduce the need for more invasive procedures down the line.
Okay, that's a big potential benefit.
Anything else?
Yes. There's also a strong economic argument emerging. Another retrospective analysis found that for patients dealing with low back pain, total insurance payments for episodes of care that began with a chiropractor were almost 40% lower than those initiated with a medical doctor.
40% lower cost. Almost. And even after they adjusted for various risk factors, trying to make it a fair comparison again, the costs associated with chiropractor-initiated care remained 20% less expensive.
So potentially safer and less costly.
That's what these findings suggest. It really builds a case for early chiropractic care for spinal pain, not just as a safer option regarding opioid use, but also as potentially more cost-effective and maybe a more efficient use of healthcare resources compared to just conventional medical care alone.
It really does sound like a potential win-win for patient safety and maybe the healthcare system overall.
That's certainly the implication.
Of course, no single study is perfect. Good science always acknowledges its limitations, and this paper did that, right? What were some of those points the researchers mentioned, just so you, our listener, keep them in mind?
Yes, they were very transparent about that, which is always a good sign. For instance, they acknowledged their data excluded Medicare Part C claims.
I mean, what does that mean practically?
Well, it means some beneficiaries, perhaps those enrolled in Medicare Advantage plans, who might have different healthcare access or patterns, weren't captured in this particular data set. So the findings might not generalize perfectly to all Medicare recipients.
Got it. Anything else?
Also, the study primarily equates chiropractic care with spinal manipulation, because that's typically what Medicare Part B reimburses for chiropractors.
So it might not capture the full scope of what a chiropractor might offer, like exercises or advice?
Potentially, yes. The focus was on the manipulation aspect due to the claims data. And it's also worth noting the data ended in 2016.
Ah, right. Before some of the really big shifts we've seen more recently in the opioid crisis.
Exactly. Before the increased prevalence of things like fentanyl and other illicit opioids really changed the landscape. So the context has evolved somewhat since the data was collected.
Okay, those are important points. So given those limitations, how did the researchers themselves view the strength of their conclusions? Did they still feel confident?
They did. They argued that despite these limitations, the rigorous methods they use, like those one-year risk estimates, the careful adjustments, the propensity scoring we talked about,
right,
that these methods still allow for pretty strong inferences regarding the association they found between chiropractic care and reduced opioid use. They really worked hard to limit confounding factors.
All right.
So the core finding, that reduced opioid risk, especially with early care, it seems robust based on their analysis.
That's reassuring. So, okay, let's bring it all back home for you listening. The core takeaway from this deep dive seems incredibly clear and, frankly, quite empowering.
I think so.
Chiropractic care, particularly when you start it early after a spinal pain diagnosis, really presents itself here as a safe, effective, and evidence-based alternative for managing that pain. And perhaps most importantly, based on this study, it significantly cuts the likelihood of needing or being prescribed opioid medications.
Especially for older adults who are often at higher risk from opioids.
Exactly. This research strongly suggests that considering these non-drug alternatives isn't just, a matter of preference, but potentially a really smart health choice.
Yeah.
It's about improving patient safety and finding ways to get pain relief that avoid the well-known hazards of prescription opioids.
Absolutely. And maybe to leave you with a final thought, something to mull over. The study itself concludes that the next logical step in research should be, and I'm quoting here, systematic dissemination and implementation of these findings.
Systematic dissemination and implementation. What does that mean for our listener?
Well, it means taking this valuable evidence-based information out of the research papers and getting it into actual healthcare practices.
Right.
And critically, into everyday conversations between patients and doctors. It directly impacts how you might seek care for spinal pain and how you can advocate for yourself or maybe for loved ones for non-pharmacological options first.
So it's about making this knowledge actionable.
Exactly. Don't hesitate to explore these evidence-based options. Talk about them openly with your healthcare providers. Consider them not just as a last resort, but potentially as a frontline choice for managing your pain safely and effectively.
Thanks for tuning in to the Spinal Chat, a service of the Pennsylvania Chiropractic Association. You'll find links to the full study and other resources in the show notes. And if there's a piece of research you'd like us to unpack in a future episode, reach out. We'd love to hear from you. To strengthen the voice of chiropractic in Pennsylvania, contact your legislators, support the PCA PAC, and, if you haven't yet, become a PCA member today. If you enjoyed this episode, share it, subscribe, and stay connected for more insights, stories, and science shaping our profession. Until next time, stay curious, stay engaged, and keep advancing chiropractic care in Pennsylvania.